morning, everybody, and thank you for inviting me to present this morning. So, indeed, I'm Béatrice, and I work at the Joint Research Center of the European Commission, and I'm leading this Survey Method and Analysis Center, which is called SMAC. So, what I'm going to do today is to take you through a question that sits at the heart of what we do, and namely, how do survey data support EU policy making? So I have about 30 minutes, a bit less, and I will walk through the mission of the GRC. I'm not sure, perhaps some of you are not familiar with the GRC and the mission of SMAC as well. And I will share some concrete example of how we have used survey recently to inform policy, and including an important study on loneliness in Europe. And in relation to this, also some work, which is very much linked to the topic of today, on the relation between social media use and adolescent well-being. So let me start with the Joint Research Center. So some work on the institution I represent this morning. So the Joint Research Center is the European Commission in-house scientific service, right? So our mission is to provide evidence-based knowledge to support EU policies. So the word on the left-hand side of the slide somehow captures what we do. We try to anticipate upcoming challenges. We, of course, connect scientific evidence to the policy process, and hopefully we do have a positive impact. And so, of course, we are not a traditional research institute, if I may say. Why? Because we work directly with policymakers, and our added value lies precisely in that interface between governance and science. So this is about the GRC. The GRC has about 2,700 people that are spread across 6 sites. One of them is where I work at the moment. It's in Italy, in Ispra. It's the biggest site, I must say, of the six. And we do offer expertise and competencies on a wide range of disciplines to support almost all EU policy areas. So for those of you who might be interested, they are regularly positioned for trainees as well as contractual agent position. We will soon, for instance, open a position for a survey methodologist. So let me go on with the survey method, the survey data at the GRC, and more specifically, the Survey Method and Analysis Center. It's a very small group that was recently established. So how do we work? Again, this is what makes us a bit different from a research institute. So normally every broad project, particularly a survey project, is grounded in a policy question, right? And in this center, or SMAC, we offer to policy DGs, but also to our colleague at the GRC, support on survey method and data analysis. So we can help with designing questionnaire, with conducting and relating with a survey contractor. And of course, we also support our colleague with data analysis. And at the end, we try to translate those findings into policy relevant insights. So I will come back on this in a minute, but let me come back again on why survey somehow can be useful for policy making, right? So first of all, it gives a voice to people. So it's a way to capture opinion, perceptions, and if we repeat the survey over time, we can track those opinions or perceptions, for instance. Importantly, and I will come back on it, it also support policy making directly by identifying, for instance, policy priorities, or by testing acceptance of measures before implementing them, or again, by understanding the driver of some specific attitudes. But I will come back on it. It's relatively easy to implement, but not that easy, but it's relatively easy. But of course, surveys do have their own limitation that needs to be underlined whenever it's used for policy purposes, and limitation that might be due to the sampling frame, that might be due to the way questions have been asked, or that might be, for instance, related to response rate or low response rate. So we have to be aware of this when we use survey for informing policy. So how can survey assist policymaking? I like to come back on three examples. One of them is survey can help setting priorities, right? When the policy is multidimensional, say for instance fairness or green transition, survey can help can help us understanding what citizens care about most, right? What matter to them? What should, for instance, policy energy be directed first? So this is a way survey can assist policy making. Survey can also help testing policy acceptance. So before introducing a new policy, say a carbon policy, or even more recently, a policy on restriction on social media access for minors, survey can help to understand the public reaction. It might be a policy might be rational, but might face resistance. So survey could help you anticipate this. So this is another way survey can assist policy making. Understanding attitude also. Why do some groups, for instance, resist vaccination? Why are young people more likely to distrust institutions? So a survey, again, can help us understanding this better, provided that the survey is properly designed. And so if we understand this, then we can target communication or intervention for instance, those young people that distrust institution, just to give you an example. So this is the way a survey can assist policy making. Let me now give you an example of a big project we have been working on for several years. And this is a good way to illustrate how survey can help policy decisions. So this was a project that started a long time ago, back in 2021, basically, even a bit before. And we decided to work on loneliness, and we were requested to work on loneliness. Why? Because at that moment, loneliness was on the rise, particularly after the COVID pandemic. And as a matter of fact, there was a lack of comparable EU-wide data on this topic. So we have designed a project with our counterpart DG Employment and together with the European Parliament around 6 stages. So first of all, we synthesized the evidence to understand what we knew and what we didn't know at that time. Then we designed an EU-wide survey fully dedicated to loneliness, and I will come back on this. Then we mapped intervention to tackle loneliness, and we discussed with stakeholders. So this is where survey can be complemented by more qualitative information, where we complement survey data collections with, for instance, qualitative interviews. So this is what we did, and we tried to disseminate what the work. At that time, when we started to work on loneliness, the research community was spread across different disciplines. And so what we tried to do is to put those scientists together and together also with colleagues from Brussels and so with policymakers. So we have organized a number of events online and also in Brussels in particular to discuss loneliness prevalence in Europe, the challenges and the consequences of loneliness. The GRC, as I said before, is also a research center. And so we have also published a number of academic papers and books on the topic to advance the knowledge on this. And at the end, we went back to the European Parliament during an hearing and we discussed loneliness in Europe and the challenges. So this is really a project that gives you a feeling of what we do at the GRC and how survey can be used for policy making. So let me say a few words about this survey. So this is a survey that was conducted end of 2022, was conducted online. It covered about 30,000 respondents. It was really the first survey dedicated to loneliness. So we have included a number of items on loneliness, and also what we have done is to design a number of modules that would allow us and researchers outside that would allow us to look at the factors, the risk factor of loneliness, but also at the consequences of loneliness. So, for instance, we have a specific module dedicated to social media, and I'll come back on it. And we also have detailed information on, for instance, childhood experience, which is not that common. So what did we find? Well, what did we find? The headline figure are striking, I would say. 13% of respondents reported feeling lonely most or all of the time. This is not marginal. So then 36% but, of respondents report feeling lonely at least some of the time in the past 4 weeks. Who are the most affected? Well, contrary to the common stereotype on loneliness, we feel that we all believe that loneliness is an issue of all people. Actually, what we found is that loneliness is particularly high among young people and among women in particular. We have also found that LGBTIQ respondents are more likely to feel lonely. Again, on this, let me say a few words. It's the surveys collecting information on sexual preferences or sexual orientations are not that many, particularly in Europe. And this type of information, the fact of collecting this information allowed us to highlight some struggle that LGBTIQ are facing in terms of health, mental health, in terms of loneliness, for instance, and this has been used in a number of policy documents. So we have also observed, for instance, that adverse childhood experience correlate very strongly with loneliness. Of course, we have much more, and you can consult our website if you want to know more or to look at this book, which is available online. So what were the policy implications of this project? Really, I truly believe that we contribute to raise awareness about loneliness and social isolation. As a matter of fact, now there are Horizon projects which are following this project that are on loneliness, and I'm sure that this will continue. So this is very good. We pushed very much to include a loneliness item in surveys. I think it's the case in the Chronos, but also in surveys, for instance, that target young people. We also highlighted, and this is a bit aside from surveys, but the need to collect proper data to measure the impact of loneliness intervention. Impact evaluations are of relatively low quality when it comes to measuring the effect of loneliness intervention, and I think this is also a call for more research on this. We have also identified a number of knowledge gaps through the survey. And, many people, and it's very standard to say that the built environment is very important to foster social cohesion or to prevent loneliness. But we know very little, actually, on the real impact. And so this is what this work and the data collection has highlighted. And we have also contributed to provide new evidence on driver and consequences of loneliness. So let me now move to another topic, which is very much linked to the topic of today, right? And somehow this work was built on this data collection on loneliness. And after having worked with DG Employment on this project and the European Parliament, we started to work with DG Education and Culture on a project linking the use or trying to examine or assess the link between social media use and loneliness among young people. So you all know the context very, 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 very well, right? So social media has doubled since 2015. We have about 5 billion users around the world, and young people are clearly the most engaged users. Over the same period, we have also observed a decrease in the, an increase of emotional disorders among young people. And so naturally, there is very much debate on the news, but also the political area on the potential causal effects of social media on the mental health of young people. So there is some scientific evidence suggesting that indeed social media foster loneliness and distress. And there are also other papers or scientific evidence that argue that the effects are minimal and very much depend on usage pattern. So this is a bit the context. But as a matter of fact, there was clearly a lack of EU-wide evidence on this. And this is where we come in, if I may say, because we could provide, although not in a clean causal way, we could come up with a study at the EU level on the link between intense use of social media and loneliness and emotional disorders. As I was saying before, this survey contained detailed information on social media use in terms of time, patterns, and motivation. And of course, we also have collected other information that is very important if you want to assess the link between social media and emotional disorder. And in particular, for instance, the use of other digital tools, because there is social media and there are a bunch of other digital tools, whether it's gaming, TV streaming, and so on and so forth. So at the request of our colleague in Brussels, we started to look at the link between spending more than, this is what we call intense use of social media, spending more than 2 hours on social network sites and spending more than 2 hours on instant messaging tool, on feeling of loneliness and on feeling of depression and nervousness. Actually, it's not sadness. So this work, again, is very much policy relevant. The European Commission President announced 2 years ago that we will convene the first ever European-wide inquiry on the impact of social media on the well-being of young people. And there has been also, over the past years, a number of initiatives at the EU level and also at the national level, as you know, I'm sure, on this, including the European Strategy for Better Internet for Kids or the Digital Service Act, and so on and so forth. So the work is clearly relevant. Let me now present a few findings quickly. So in terms of statistics, just for you to know, to have an idea, the survey shows that about 20% of women report to feel lonely all or most of the time. The figures are slightly lower for males, and similarly, women are more likely to suffer from emotional disorder compared to male. In terms of social media use, 1/3 of girls or women spend more than 2 hours per day on social network sites. And again, the figure a bit lower for men. And of course, the younger, this is on the right side of the slide. And of course, the younger the respondents are, the more they spend time on social media. So those are some summary statistics. And here is a table which might be not very nice to look at, but what does it show? So the first part of the panel A, shows you that intense use of social network sites, so, Instagram, of course, now it's difficult to make a distinction between instant messaging tool and social network site. It was easier at the time. But so the more time you spend, if you are an intensive user of social network site, the chance you feel lonely all of the time or most of the time is increased by 10 percentage points. And what is interesting is that this figure is robust to a number of things, to whether we take I forgot to say that for this study, we focused on individual age between 16 and 35. But if you restrict your sample to a sample of, for instance, respondent age between 16 and 30, you get exactly the same findings. So the findings are robust to the definition of young adults. We also have a number of loneliness and emotional disorder measures in the survey. We do observe the same findings. We also can, if we control, for those who do econometrics in the Bloom, if we control for loneliness and mental health during childhood, we still get this finding. If we also account for the time spent on other digital tools, and namely gaming and TV streaming, we still get this. And so our results are also robust to all of this, and also to the regular participation in sport and cultural activities. So this is more than bivariate statistics. It really tells you that accounting for all of this, intense use of social network site is associated with more loneliness, with more depression, and with more nervousness. Of course, there are moderating factors. Females, the adverse effect of intense use of social network site tend to be stronger for female, and also is much stronger for individuals who to have small offline social network. So this suggests that social media might be particularly harmful when it substitutes for rather than complement in-person relationship, right? Of course, I have to say we have to be careful. We don't have a clear causal, identification strategy. So we have to be careful when we come with causal interpretation. So this has been very much. We have produced policy brief, policy report, and of course papers, but policy brief really to show this and to discuss this and to feed our counterpart in Brussels. So what we have found is that excessive use of social network sites is associated with higher level of loneliness and emotional distress. The adverse effects are particularly strong for females and for individuals with smaller offline social network. But also what we have been pushing for is that, so this was the first EU-wide survey with detailed information, for instance, on loneliness and intense use of social media use. But this is not enough. We need to come with longitudinal studies. Everybody is talking about, I have to stop, right? Everybody is discussing about the mental health pandemic of young people. If we want to know more on this, we need to collect longitudinal data. And so to go beyond cross-nationally, and we need to collect more data on minors, which is extremely tricky, of course, particularly if the data is longitudinal. So we are pushing very strongly for this. I'm not sure we will win, but what we do now, we want to investigate the effect of social media on adolescents and not on young people, and we aim to validate and design a survey instrument to measure this, to pilot the survey in a number of schools, if possibly, and then to lay the foundation for EU-wide longitudinal study on adolescent well-being. And this is, of course, work in progress. So in conclusion, I will say that I don't have my conclusion slide, but in conclusion, I will say that surveys are clearly a powerful tool for policy, right? Because it gives us the opportunity to hear people, to reveal patterns at scale, to change, to observe change over time. When the survey is well designed, it can really shift a policy agenda. I think the work on loneliness has shown this end-to-end, from the data collection side, moments, to the hearing at the parliament. And so I'm going to stop here, and of course, I'm happy to take your question in case you have. Thank you very much.